Hi, my name is Samantha Simonetti. I'm a student physical therapist here at Campbell University, and today I will be talking to you about the Tinel sign test of the wrist. First, I'm going to talk to you about the science behind the test itself. The Tinel test at the wrist is a technique used in assessing the wrist for carpal tunnel syndrome. The median nerve, which becomes irritated with the diagnosis, runs through the carpal tunnel. This tunnel is created by the flexor retinaculum, which attaches, is a thick connective tissue which attaches at the hook of the hamate and the pisiform, as well as the scaphoid and the trapezium. So here I have the bones to kind of give you a better explanation as to where the carpal tunnel occurs. You'll see that the scaphoid and the trapezium here is the radial side where the flexor retinaculum attaches, and then it comes across to this area here, which is the hook of the hamate and the pisiform. You can see that this area, this tunnel it creates, is very small. It houses the flexor digitorum profundus, superficialis, and the flexor pollicis longus, as well as the median nerve. So because there's these tendon structures with the nerve, those tendon structures can become irritated and close down that small tunnel area, pressing and creating more pressure on the nerve. When that occurs, most likely the patient will have neurological symptoms such as numbness and tingling of the first 3 digits on the palmar side. They might also have some numbness and tingling on the dorsal distal 3 digits as well. So this test, we will be tapping along the median nerve structure and seeing if we can get reproduction of those symptoms. So first off, I'm going to show you step by step how to perform this test. I'm first going to have my patient come in and we're going to show patient position. So Phil, what we're going to have for a patient position is you want the patient in a seated, relaxed position in which you can access the distal part of the upper extremity. You'll have them in a supinated position so that you can access the carpal tunnel, as we were talking about. You can either support the wrist with your opposite hand, because you'll be performing with the other hand, or you can simply allow the table to support the wrist. So in this case, I will be using 2 fingers to tap on the area, so I will support with this hand. And what you want to do is tap along that carpal tunnel, or you can tap a little bit closer and proximal. The Dutton book suggests 3 to 4 taps. You'll see that there's several articles that have different amounts of tapping as well as different locations. But particularly, we're going to be working with the Dutton orthopedic textbook, in which case they say 3 to 4 taps is sufficient in this area, looking for that reproduction of pain. You can also use a reflex hammer to do the same thing, and you're looking to see if they have any numbness or tingling in those first 3 digits. So another thing that I'm going to explain now is how you would then explain this to the patient. So Phil, I know that you've been having some wrist pain and numbness and tingling. So to rule out carpal tunnel, we're actually going to do a series of neurological exams. And the first one we're going to do is just testing the nerve that runs along your wrist. We're going to be tapping along it to see if we get any of that tingling. Okay? So when it comes to the scientific findings behind this test, we found that the Dutton orthopedic book specifically talks about 60% sensitivity and 67% specificity. Due to the low number of these percentages, you would most likely examine the patient with a series of neurological tests, not just this one by itself, because it is not strong enough to give you the findings that you need. Other tests that you might do include upper limb tension tests or anything else neurologically for the upper extremity. And that will be all for today.